I'm a pediatric nurse, and I'll never forget the 6-year-old who asked me to teach her how to change her bags. When I asked why, she said Parch is sick and I want to help her get better. Working in pediatric oncology, you think you've seen everything that can break your heart, but sometimes a child will say something that stays with you forever. Last month, a little girl named Sophie was admitted for routine chemotherapy. 6 years old, pigtails, and the brightest smile despite everything she was going through. Her mom, Jessica, never left her side. During Sophie's 3-day stays, Jessica would sleep in the uncomfortable chair next to her bed, holding Sophie's hand through every treatment. What struck me was how attentive Sophie was during her care. Most kids her age try to avoid looking at the medical equipment, but Sophie watched everything I did with intense concentration. She'd ask detailed questions about the machines, the medications, the procedures. Why does that beep mean? How do you know how fast to make the medicine go? What happens if the tube gets tangled? I thought she was just curious, often cope with medical trauma by trying to understand what's happening to them. But then Sophie started asking different questions. Miss Jenny, do grown-ups get the same kind of sick medicine as kids? Could you teach me how to change those bags when they're empty? I was confused, 3D. That's my job. You don't need to worry about that. Sophie got very serious. But what if you are not there? That's when I noticed Jessica looked exhausted beyond what I'd expect even from a parent dealing with pediatric cancer. She was pale, had lost weight, and sometimes I'd catch her wincing when she thought no one was looking. During Sophie's next admission, I gently asked Jessica how she was holding up. Oh, I am fine, she said quickly. Just tired from all the hospital stays, but Sophie overheard and said something that made my blood run cold. Mommy's sick too, but she says we can't tell the doctors because then they might not take care of me anymore. Jessica's face went white. Sophie, honey, you don't need to worry about patches, but Sophie continued. Biatches throws up every morning and she has lumps in her neck. She thinks I don't see her crying in the bathroom, but I do. I looked at Jessica, who started crying. I found a lump 3 months ago, but Sophie's treatment is more important. I can wait. This mother had been hiding her own cancer symptoms because she was terrified that seeking treatment would interfere with her daughter's care. I can't leave her, Jessica whispered. What if something happens while I am getting tests? What if they schedule my appointments during her chemo days? Sophie grabbed my hand. That's why I want to learn to help Patchage. If I know how to take care of sick people like you do, then Prateses can get better too. My heart shattered. This 6-year-old was trying to become a nurse so she could take care of her mother while battling cancer herself. I immediately called our social worker and patient advocate. When 2 hours we had coordinated Jessica's medical care to work around Sophie's treatment schedule. The oncology team upstairs agreed to see Jessica during Sophie's infusion days. Our child life specialist arranged for Sophie to stay in our playroom with supervision when Jessica needed tests. But the most important thing was explaining to Sophie that taking care of sick people required special training that takes years to learn. Your job is to be 6 years old, I told her. Fix the learning, being brave during your treatments. Let the grown-ups take care of the grown-up worries. Sophie looked skeptical. But what if Patches needs help and no one's there? I knelt down to her level. Sophie, your mommy has been taking care of you so well because she loves you. Now it's time for all the adults who love both of you to take care of your mommy. 2 weeks later, Jessica was diagnosed with stage 2 lymphoma, treatable but requiring immediate intervention. Sophie was in the playroom coloring when Jessica got the news. When I told Sophie that her mommy would need medicine like hers, Sophie nodded seriously. Sophie thought for a moment. Then we can be bald twins. That might be fun. Jessica started treatment the following week. On days when both of them were receiving chemo, Sophie would insist their beds be pushed together so they could hold hands. See, Pashies, now you don't have to be scared because I know all about the medicine and the machines. Both of them are responding well to treatment. Sophie's tumors are shrinking, and Jessica's lymphoma is in remission. Last week, Sophie brought me a drawing of 2 stick figures in a hospital bed holding hands with a stick figure nurse with a big smile standing nearby. That's you helping me and Prahashes get better, she explained. Thank you for teaching me that some jobs are too big for 6-year-olds. At the bottom of the drawing, in her careful first-grade handwriting, she'd written, when I grow up, I want to be a nurse like Miss Jenny so I can help sick kids and their mommies.